Welcome. Today we're going to speak about malaria. By the time you finish this session, you should be able to speak comfortably about the burden of disease related to malaria, who is most affected by it, the risk factors for malaria, the health and economic consequences of malaria, and what can be done to address this disease. Let's start by talking about what is malaria. Malaria is a parasitic disease spread by the bite of a female Anopheles mosquito. In the simplest terms, the mosquito bites someone with malaria in their blood and then passes on the malaria to the next person when it bites them. Malaria can be transmitted by 5 species of parasites. These species of parasites are shown here, and the locations in which they're most prevalent are shown on the right. Let's look now at the burden of disease and some basic facts about malaria from 2013. There are about 3.3 billion people, about 3.3 billion people in the world in 2013 who were living in places where malaria was endemic, where they were at risk of malaria infection. There were almost 200 million cases of malaria that year. The number of malaria deaths is coming down, and coming down substantially, but there were still almost 550,000 people who died of malaria in 2013. And it's important to note here these 2 facts. One is this is overwhelmingly a disease that kills people in Africa. About 90% of the total deaths were in sub-Saharan Africa. And 2, almost 80% of the total deaths from malaria occurred in children under 5 years of age. And in fact, this highlights the point I made about the global distribution of prevalence. Malaria is the 10th leading cause of death for all ages and both sexes globally. However, it's the 3rd leading cause of death globally among children under 5 years of age. For the sub-Saharan Africa region, however, malaria is the leading cause of death both for all age groups and for children under 5 years of age. Let's talk for a second about risk factors. The most important risk factor for malaria is being bitten by mosquitoes that carry the malaria parasite. This risk varies with the feeding habits of various species of mosquitoes, the climate, the time of year. In addition, some people have a degree of immunity to malaria from having grown up in malarial zones. And the risks of contracting malaria increase if one does not have such immunity. Malaria is also a really important issue in pregnancy. Pregnant women who contract malaria are at high risk of giving birth to low birth weight children. Malaria in pregnancy is also associated with spontaneous abortion, stillbirth, premature delivery, and severe anemia in the mother and in the baby. Now, malaria has really substantial health and economic consequences. The cost of malaria at the family level is substantial because individuals often have malaria multiple times per year. In one study in Ghana, for example, there were 11 cases of malaria per household per year on average. These same studies showed that individuals lost 1 to 5 work days every time they got malaria, and that the indirect cost of dealing with their illness through lost work, lost wages, etc., was substantially greater than the direct cost of treatment. And each episode of malaria was estimated to cost an adult about 2% of his or her annual income. In addition, in many countries in sub-Saharan Africa, malaria accounts for up to 30% of outpatient visits to hospitals and a substantial share of hospital admissions for children under 5 years of age. In fact, it's been estimated that about $12 billion is lost annually due to malaria alone. In fact, the Rollback Malaria Initiative has suggested that countries with a high burden of malaria might be losing just over about 1% of their gross domestic product per year just as a result of the economic costs of malaria. Clearly, malaria in sub-Saharan Africa is an important deterrent to trade to business development, to tourism, to foreign investment, and in fact, to overall development. Now, despite many years of effort, there's still no vaccine against malaria that is approved and now in use. There's a lot of work going on in the development of a vaccine, but there's no vaccine yet approved or in use or licensed in any country. However, there is widespread agreement on the key interventions that should be taken to address malaria. And as I mentioned, there's been important progress, really important progress in the last decade or so in disseminating these interventions more widely and reducing the burden. So let's look at what these key malaria interventions consist of. The first is prompt treatment of those infected based on confirmed diagnosis. And you'll see in the next slide we put confirmed in capital letters because it's important that people not be treated presumptively because they might not have malaria and then you could breed resistance. It's important that people be treated on the basis of a confirmed diagnosis. It's also important that pregnant women, because of the important relationship between pregnancy and malaria and the deleterious impact of malaria on women and their children, that intermittent preventive therapy offered for pregnant women. Long-lasting insecticide-treated bed nets for people living in malaria zones is very, very important, and we want everyone in those areas to be sleeping under a bed net. Having said that, many of you who are familiar with, or at least somewhat familiar with malaria, might think that this is the only thing you need to do, and it's important to understand that each of these elements is critical in reducing the burden of malaria. And indoor residual spraying of the houses of people in malarial zones is also important. Now, I didn't put on this graphic because most of us know it already, but of course, it's also very important that where possible, measures be taken environmentally to try to reduce the number of mosquitoes who are breeding in the area where you live. This is easier in some places where you have urban settings where you can remove tires or flower parts in which water might collect. It's much more difficult in places where it rains a lot and where there are mosquitoes everywhere, where mosquitoes are ubiquitous. Appropriate treatment of malaria is really essential to reducing malaria morbidity and mortality. If people with malaria are treated promptly, diagnosed with a confirmed diagnosis and treated promptly, then the mosquitoes that bite them will not carry malaria to another person. Historically, a number of drugs were used to treat malaria, but resistance has grown to almost all of these drugs. And today, the World Health Organization recommends what they call artemisinin combination therapy be used for treating uncomplicated malaria caused by P. falciparum, which you saw before, and Plasmodium vivax infections that are not responsive to chloroquine. In fact, the use of artemisinin combination therapy has grown enormously from around 11 million courses in 2005 to almost 400 million courses in 2013. And intermittent treatment for pregnant women has also been growing. Traditionally, malaria was diagnosed on the basis of a blood smear. Blood was taken from someone suspected of having malaria. Blood was placed on a slide, and people looked for the malaria parasite. Increasingly, however, people in endemic areas are using a rapid diagnostic kit that works very well. It's specific and it's sensitive to diagnose malaria in ways that are easier than taking blood and looking to see whether or not you can see the parasite on a slide. And the use of these kits has also grown enormously from about 90 million in 2010 to almost 320 million in 2013. The use of long-lasting insecticide-treated bed nets has also grown. In fact, it's estimated that over 200 million bed nets were distributed in 2014, which would be almost 3 times as many as were distributed in 2012. And although there are many people, unfortunately, still not sleeping under a bed net who should be, the latest estimates are that something close to half of all of the people at risk are now, in fact, using long-lasting insecticide-treated bed nets. Indoor residual spraying has also increased. Pyrethroids have been the insecticide of choice. There's a lot of attention to trying to ensure that resistance doesn't develop to these insecticides. And DDT is also approved for such efforts. And the use of these insecticides will hopefully be carefully monitored, with assessments made to examine resistance and efforts to rotate the insecticides in ways that will slow the development of resistance to them. And again, particular attention is being paid to the environmental risks of these insecticides as well. Now, despite really substantial progress in reducing the burden of malaria and the number of malaria deaths, there remain some really critical challenges to trying to eliminate malaria. And the world has set some important goals for trying to address malaria by 2030. One would be to reduce malaria case incidence by at least 90%. Another would be to reduce malaria mortality rates by at least 90%, to eliminate malaria in at least 35 different countries, and to prevent a resurgence of malaria in places where, which are already malaria-free. But as I began to say, there are a number of efforts that will need to be taken if these goals are to be met. And let's look at a graphic that speaks to those efforts. The first really is to build on the progress that's been made and to ensure that the interventions that we know are central and cost-effective and doable and affordable, they're actually taken to scale. Another, as we talked about, is increasingly trying to ensure that treatment is based on confirmed rather than presumptive diagnosis. We want to ensure that people are treated as early on, as I mentioned, in their disease as possible, in order that one can reduce the number of infections that can be caused by mosquitoes that bite them and then go bite one of you. Here, as in a number of other diseases, including tuberculosis, there's an important role for the private sector. The private sector is very deeply involved in the treatment of malaria. And yet here, too, that treatment might not always be according to recommended or standard protocols. And countries that have an important burden of malaria and an active private medical sector or active private pharmaceutical sector, lots of kiosks in which people get their first-line treatment, they will need to work carefully with the private sector to try to ensure that the treatment of people becomes more and more standardized based on the right kind of drugs at the right time. Despite the enormous progress and the extent to which artemisinin in combination therapy has been effective, resistance to that artemisinin combination therapy began to develop as soon as the drug was put into use. And it's very, very important, given the relatively small number of drugs against malaria that still work, that the world continue to make important progress as rapidly as possible in the development of new, safe, effective, and affordable anti-malarial drugs. If that doesn't happen, we risk becoming a world in which drugs work less and less well against a disease that's very, very common. And of course, although there's not yet been a safe, effective, approved, and disseminated vaccine against a parasitic disease, there has been important progress in the development of malaria vaccines. And one can only hope that a safe, effective, affordable vaccine that will be easy to use in the countries that are endemic will be able to be developed as rapidly as possible, and a substantial amount of effort is underway to make that happen. Hopefully, you're more familiar than you were earlier with the nature of malaria, the burden of disease of malaria, who's most affected by it, and what can be done to address it. I hope you also understand better than you did before the important health and economic consequences of malaria. In the next session, we're going to talk about neglected tropical diseases.